Hi everyone, I'm Dr. Kelly and
Hey, I'm Dr. Samina.
we're two of the naturopathic doctors at the White Lotus Clinic in Toronto, and we just wanted to pop on Instagram and talk a little bit about insulin, what insulin resistance is, how it relates to PCOS, and what you can do to actually fight insulin resistance. So what is insulin? Insulin is a hormone. It is released from our pancreas when we ingest sugar. So when we have a carbohydrate, bread, pasta, flour, rice, our digestive system breaks that down into smaller molecules of sugar. We absorb it, it moves into our bloodstream, and that causes the pancreas to secrete insulin. Insulin then moves to the cells and causes the cells to have a receptor move to the surface of the cell that can then bind to blood sugar, and blood sugar moves into the cell. So the goal of insulin is really essential, is to get blood sugar from our bloodstream into our cells where they can produce energy and do all of the amazing things that we need them to do.
Yeah. So insulin, actually, I think when we think of diabetes, oftentimes, even in PCOS patients, we're always thinking about glucose, and we always forget about thinking about insulin, because insulin is actually what is used to bring glucose into the cell. So I think oftentimes you have this conversation of doing like an oral glucose tolerance test, but even like using or looking at insulin too during that time is really important, so that we can see what's happening with insulin.
Yeah, exactly. Right? Like you need insulin at all times, or you would actually die.
So insulin is really important, especially in PCOS patients. And oftentimes what can happen is you can get something called insulin resistance. So now what happens is typically in PCOS patients, insulin kind of rides high in the bloodstream, and so now the cell is being bombarded with a lot of insulin, and so the cells end up becoming resistant to actually using insulin on its receptor sites, right?
Yep.
And then what can really be the issue is now we have high insulin and high glucose in the bloodstream because the cell isn't using insulin to bring that glucose in. So this can cause a variety of different issues. I think one of the biggest issues that we see is weight gain, and really managing your blood insulin and blood glucose can help you to manage your weight, especially in PCOS. So
yeah, some of the other things we see a lot are like dizziness, nausea. So when with insulin resistance, what happens is their insulin is it has an exaggerated response when they have a carbohydrate, and because insulin goes so high, blood sugar eventually drops, and then they get what we call is hangry. So angry and hungry, because their blood sugar actually drops dramatically. So if you're getting like hangry and irritable and dizzy, that could definitely be a sign of insulin resistance.
Yeah, and oftentimes we also call this hypoglycemia.
Yeah.
And so really figuring out what you can do with your diet and lifestyle can really impact these symptoms of feeling hangry. One of the biggest things we always talk about with patients is diet and lifestyle. And the biggest thing is diet. Really making sure that you include protein and fats in each meal, because instead of you getting this high spike in insulin and glucose, actually, you won't get as big of a spike if you add protein and healthy fats into your diet. So good healthy fats are things like coconut oil, nuts and seeds, avocados are our favorite, chia seeds, olive oil, lots of good healthy fiber too, because that will help to slow down metabolization and actually reduce blood glucose. So things like flax seeds and psyllium husks, those things are really important in a case like this.
So diet we recommend for anyone who's struggling with insulin resistance. In some situations, women will need a little bit more support if their fasting insulin is really high, or if you have run an insulin glucose tolerance test and you do have that exaggerated insulin response when you eat a carbohydrate. In those cases, sometimes we'll incorporate supplements. Myo-inositol is one of the main things, especially if a woman has PCOS. Chromium is also very helpful for insulin resistance, sometimes berberine as well. Of course, I would not recommend anyone take these unless you're under the care of a healthcare practitioner, but those are just some of the treatment options that we commonly incorporate when we see this.
Yeah, and myoinositol is really great because what it does is it actually helps to sensitize those cells, like resensitize them to insulin, so that insulin can bind and bring the glucose in. And it's actually been studied against metformin and with metformin, and it's actually been shown to be just as effective as metformin, and actually together works really well. So it's perfectly safe to take together with metformin, but also just keep in mind that anytime you add something like any supplement, make sure you get advice from your naturopathic doctor. And we said lifestyle too, so exercise is really important. Honestly, you'll find even with diabetes, if you take like a 10-minute walk, even like after a meal, like an hour after, say you test your blood glucose, you take you see the number, and then you go for that 10-minute walk, you come back, you test your blood glucose again, you will notice a drop in blood glucose. So actually the action of movement actually helps to I guess pump the muscles, and this helps to even bring insulin and glucose into the cell. So even just a little bit of movement can actually really improve insulin resistance.
Yeah, that receptor, right? The receptor that moves to the surface of the cell to bring in the blood sugar, it moves without insulin when you exercise. So you actually don't need insulin to move blood sugar into the cell when you exercise, which is really cool.
That's awesome, Cool. What else do we have? Botanicals.
Botanicals.
You said berberine.
Yes.
So berberine is really intense botanical. We only recommend it for certain patients who are significantly insulin resistant. So that one, definitely you need to speak to a herbalist or a naturopathic doctor. It's really important.
Yeah.
Is that it?
I think so.
So if you guys have any other questions, please let us know. You can direct message us. But we're here at the White Lotus Clinic. We treat a lot of insulin resistance. Probably every single day we see a patient with some kind of insulin resistance.
Yeah, absolutely.
And we're always super excited to chat and help educate patients about it.
Yeah, absolutely.
Take care.
Bye, everyone.
Have a good weekend.